All right, think about this for a second. A staggering 25%, that's literally 1 in 4 people over the age of 65, is living with diabetes. And if we zoom out to the general population, we're looking at nearly 10% of everyone walking around today. I mean, that's wild, right? It's a condition that is absolutely all around us. But if we're being honest, the actual mechanics of what's happening inside the human body are usually completely misunderstood.
So welcome to this explainer. Today we've got a really clear goal. We are going to visually break down and completely demystify exactly how our bodies regulate blood sugar. And, crucially, what goes wrong when that system totally breaks down. We're skipping the dry medical jargon and using some really cool visual models to solve the medical mystery of diabetes mellitus.
Section 1. A Tale of Two Patients. Okay, let's dive into this, because to really understand this disease, we're not starting with textbooks, no way. We're going to start with actual people. Let's imagine 2 completely different patients walking into the exact same doctor's office. First up, meet Joe. Joe is just 15 years old, and man, over the past few months, he's been feeling awful. He's incredibly fatigued, he's actively losing weight, which is definitely alarming because he's already a pretty skinny kid. Plus, his mom's noticed he's literally carrying a water bottle everywhere, chugging liters upon liters of water every single day. And, you guessed it, because he's drinking so much, he's constantly in the bathroom. The poor kid is actively suffering. Now, on the flip side, contrast him with Bruce. Bruce is 45, he's just in for his routine annual physical. He tells his doc he's feeling pretty good. Sure, he's packed on a few extra pounds around the middle over the years, but generally, he feels totally healthy. 0 symptoms, nothing. But here is the absolutely wild part. The doctor runs blood work on both of them. Joe because he's obviously sick, and Bruce just as a routine screening. And guess what? They both received the exact same diagnosis. Wait, what? So the big question we have to ask ourselves right off the bat is, how on earth can such wildly different situations, a really sick, skinny teenager and a symptom-free, slightly overweight middle-aged guy, be caused by the exact same disease?
Section 2. Defining the disease. Because before we can crack the case of Joe and Bruce, we got to establish exactly what their diagnosis actually means.
So both of our patients were diagnosed with diabetes mellitus. Now, you hear the word diabetes a lot, and it's actually used in a few different medical conditions. But when most people say it, they mean diabetes mellitus. And here's the kicker. It's not just one thing. It's actually a whole group of disorders. The unifying factor here, the thing they all share, is an inability of the body to regulate its blood sugar levels. And notice we specifically highlight the word glucose here. Glucose is the main type of sugar our body uses. It's literally our body's absolute favorite, preferred source of energy. It's the premium fuel keeping every single cell in your body running.
So when your body loses its grip on regulating that glucose, you end up with hyperglycemia, which basically just means having really high blood sugar. And this is the exact test result that both Joe and Bruce got back from the lab. Their blood is just saturated with too much sugar. But to figure out why it's building up in the blood in the first place, we actually need to look at how a perfectly healthy body manages its fuel.
Which brings us to Section 3, the hormone tug-of-war. Let's look at the internal biological mechanics that normally keep everything in check. Think of your body like a super finely tuned machine. It needs a perfect balance of fuel. Not too much, definitely not too little. Let's walk through the normal journey of glucose in a healthy system. Step 1, the fun part. We eat food. Step 2, the glucose from that food gets stored away, mostly in a massive storage hub, your liver. Step 3, when we actually need the energy, that glucose gets released and travels freely through our blood vessels. Think of your blood vessels like a giant sprawling highway system. And finally, step 4, the cells all over our body pull that glucose off the highway, taking it inside to use for energy. Simple enough, right? But managing all this traffic, that requires some serious regulation.
And this brilliantly illustrates how we keep things balanced. To manage the amount of sugar on that highway, your pancreas steps up as the master control center, and it deploys 2 completely opposing hormones. On one side of the scale, we have insulin. When blood sugar gets a bit too high, insulin swoops in. It tells the liver, hey, stop releasing glucose. And crucially, it helps the cells absorb the glucose that's already in the blood. Boom, blood sugar lowered. But if insulin was just running the show solo, our blood sugar would plummet dangerously low. So when sugar levels dip, the pancreas releases glucagon. Glucagon does the exact opposite. It yells at the liver to dump its stored glucose into the blood, and it halts insulin production, causing blood sugar to go back up. It's this absolutely perfect perpetual balancing act. But what happens when that beautiful balance is just destroyed?
Well, in diabetes mellitus, this delicate tug-of-war totally fails. The core issue here is that insulin is either MIA, not being produced at all, or it's just not doing its job properly. And because insulin is basically out of the picture, the effects of glucagon are massively amplified. The liver just keeps dumping sugar into the blood. But here's the real problem. Without insulin, the glucose can't exit the bloodstream to enter the cells. It's stuck. The result? Blood glucose levels just continuously rise.
Section 4. Starving amidst plenty. An energy paradox. This broken system actually creates one of the most fascinating and frankly dangerous paradoxes in human biology.
Now, what's really interesting about this slide is this concept of starvation. The blood is absolutely saturated with sugar. The body literally has more energy floating around than it knows what to do with. Yet the cells themselves, they are quite literally starving. The fuel is right there, floating right past them, but they can't access it. It's crazy. To truly grasp how frustrating and damaging this is for the body, let's look at an everyday analogy.
Okay, picture a regular city block. Normally, you've got a massive water main running down the street. That's your blood vessel. The water inside is the glucose. That water main has smaller pipes connecting straight into the houses along the street. The houses are your cells. In a healthy system, the water flows seamlessly from the street, through the pipe, and into the house. Perfect. Now imagine a diabetic system. You have the exact same street, and that water main is absolutely gushing with water. But the pipe connecting the street to the house is completely clogged, blocked solid. It doesn't matter if there's a literal flood of water right outside the front door. The house itself remains totally bone dry.
So the absolutely crucial point here is that insulin is the pipe. It's the key. Without functioning insulin acting as that connecting pipe to unlock the door, it doesn't matter how much glucose is floating by. The cells, the houses, never get the water. They never get the glucose. So the body's energy crisis just continues, sending out massive starvation signals, even while the bloodstream is turning toxic with all that excess sugar.
Section 5. Type 1 versus Type 2. All right, we've got the biological knowledge now. We finally have what we need to solve the mystery of our two radically different patients from the start of the explainer. Let's move to this breakdown and see how this builds together. Remember, we said diabetes is a group of diseases. The end result for both guys, hyperglycemia, is exactly the same, but the underlying mechanisms, totally different. Let's look at Joe, our 15-year-old who's skinny, super thirsty, and exhausted. He has type 1 diabetes. The underlying mechanism here is that his body simply isn't producing insulin at all. It's completely absent. His cells are screaming for energy, causing him to drop weight and triggering this massive thirst as his body tries to literally flush out the excess sugar through constant urination. Now contrast that with Bruce, our 45-year-old who feels totally fine. Bruce has type 2 diabetes. Bruce's body actually is producing insulin. The hormone is there, but over time, the receptors on his cells have stopped being sensitive to it. It's like the insulin is aggressively knocking on the door, but the cell just isn't answering. It's present, but not functioning normally. Now, because he still has some insulin activity, he hasn't hit that extreme starvation crisis that Joe is in. And that is exactly why Bruce feels totally symptom-free, even though his blood sugar is dangerously high.
By looking at Joe and Bruce, we can really clearly see how the exact same destination, high blood sugar, can be reached down two completely different biological roads. Which really leaves us with a provocative thought to wrap up today. If our cellular machinery can literally starve to death while surrounded by an absolute ocean of fuel, all because of one misfiring hormone, well, how can we better tune our lifestyles, our diets, and our medical interventions to make sure our bodies maintain that delicate tug of war? It's a huge reminder of just how fragile and honestly how amazing our internal balance truly is. Thanks so much for joining me for this explainer, and keep exploring the incredible mechanics of the human body.